Super Duper LifeVest rep. Greeting. Smile, folks. Come on. It's Friday. Lovely. So what we're going to talk about today is LifeVest Network. LifeVest Network is how when a patient's wearing LifeVest, this is the data that the LifeVest sends in. Tell me to move out of the way if I'm moving. So when you log into LifeVest Network, and providers, y'all we're going to work to get every provider set up with LifeVest Network here so that you have access. If you don't have a patient's name, once you log in, you can't see the patient's name once you log in, you can call Courtney or I, and we can put that patient's name underneath you so that you can view that patient's information. So it's a simple phone call. We can call tech support at the home office, and they can, within 5 minutes, they can link that patient to you if you need to have access to that patient. Does that make sense? Okay. So what you see here is you see the patient's names here, and then these are called alerts. So the first thing is patients for review. So right here we have, on this page, we have 10 patients that need to be reviewed. You have some patients that have been treated. You have orange alerts and yellow alerts. It's color-coded. Yellow is the least important. Orange may be more important, and obviously they've been treated. You definitely want to see that. Courtney, take me over to all patients. Okay, so if you click on all patients, and then you click on show all, it will show all the patients that have been enrolled under you as a provider. So what that means is if Joan writes a LifeVest for a patient, that patient is linked to Joan, so when she goes into her account, that patient's linked to her. So unless I link Joan with Laura here, Joan can't see Laura's patients because of HIPAA. So I have to link, we have to manually link Joan and Laura together. So that's what Courtney and I are working on doing, is working to link all the providers together so that y'all can see each other's patients so that we're not violating HIPAA, making HIPAA violations on that. Once you get here and you find your patient, if you cannot find your patient here, you can type the name up here. The last name, you type the last name in the box up there, you can search the patient. The other reason you may not be able to find your patient, maybe they ended use of the LifeVest last week, but they're coming to see you in clinic or coming to see you, maybe they come to the hospital and you want to see, they said, I had something happen to me with the LifeVest on, and you want to see that information. They're called inactive patients at that point. And so you can click on this box here that says active patients, unclick that box, and that will show you all patients that have worn the LifeVest, either deactivated or current patients. So by unclicking that active patient box, you can do that. Let's look at the first patient there, Adams.
You want to look at his treatment or just his?
Yeah, let's go to, just take a look. No, just click on the name real quick. All right, so when we click on Mr. Adams, we get to the alert page here. All right, we know that he's had an alert, he's got a treatment, so we can look at those events. We're not going to do that right now. But the other thing is we can look at the wear time. So click on wear time. So we can see if the patient's wearing the vest and how often they're wearing the vest. So these bar graphs, I'm trying to get out of Will's way here so you can see. These bar graphs you can see from 12 a.m. to 12 a.m. the next day. All right. So you can see the patient did not wear it here, put it on around 11 a.m., wore it to 8 p.m., took it off again. So we can see when the patient's wearing the LifeVest. We can see that probably took a shower there, maybe took it off just to let the skin air out some. So we can tell every day that they're wearing the vest, if they're wearing it or not. So let's say you want to see the patient that come to the clinic, patient wearing the vest and seeing them in clinic. I know most of y'all are inpatient, but just say someday you're covering in the clinic. You can print this out. You can hit generate report. You can print this out and have it in the chart and say, Mr. Adams, I see you got your LifeVest on today. Are you wearing it all the time? Oh, sure I am. Well, all these days here show you're not wearing it. And so what that shows us, for those patients that we do that to, the clinics actually do that, we see our compliance level go up through the roof. Patients wear it actually 23 hours a day, because those patients, they know you're watching them, so they're gonna wear it. The patients that don't wear it are typically the ones that go home and they may wear it at clinic, and the doctor goes, I'll see you wearing LifeVest, don't really mention a whole lot about it. And so they think nobody's really watching them. But if Big Brother's watching you, you're gonna wear it.
I forgot what you could do in the report.
Yeah, so what she did was she generated a report. I always like to click on the since first use box here. So generate report, since first use, and then you can click on what you want to put in that report. If you want to print the wear time, if you want to print their ECG strips, you can print all that stuff. Close that up real quick, Courtney. So this is important also. So we did wear time. The next box is all recordings. Those are just all the ECG strips. Click on that one real.
You want all recordings?
It's spinning, I can see it. Okay. So on this patient, 1, 2, 3, 4, 5, 6, 7. There's 7 ECG strips there. All right. Over here, the type. You got treated, you got automatic, manual, and baseline. Whenever a patient is fit with the LifeVest, we always do a baseline on them. We spend about 45 minutes to an hour with each patient training them how to use the vest. And the first thing we do is do a baseline when we fit them with it. And what that does is the algorithm in the vest looks at the baseline and looks at the heart rate to determine whether it's true VT or VF. So it looks at the QRS morphology from the baseline to detect the arrhythmia. So we always do a baseline. So anytime you want to see a ECG strip and you want to compare it to what their baseline was in the hospital, I think it's always a good idea to go back to the baseline. Does that make sense? Other things, a manual report. That means they push the buttons on the device. There's 2 buttons, they have to squeeze them together. They hold those buttons for 3 seconds. It'll record, just like a loop monitor will record. So we tell the patients when they go home if they're having palpitations, feeling lightheaded, feeling like anything that's cardiac related, to push those buttons and record. So that if they come see their provider, they can have access to this and see it.
How long?
It usually goes back, it backtracks 15 seconds, is it 30 seconds
30
forward?
seconds.
Yeah, so the next thing is trends. So trends, when you go to trends is for heart failure, or well, it's for any patient, but it's a lot of information, especially for your heart failure patients. The first thing, this is the summary report. But when you hit trends, then you get all these other tabs up here. So in trends, you get a heart rate trends graph right here. You get steps, how many steps you're taking each day, just like your Fitbit. You get body position. So are they up moving? Are they upright? Are they reclined? Or lying down? And then scroll so I can see down here. And then when they're lying down or reclined, what is their body angle? So this could be beneficial for if they're lying down a lot. If you see they're lying down a lot, their steps are going down and their heart rate's going up, what would that tell you? They're in trouble. They're going to come back and see you in the hospital, right? So,
Is that set up on initial
yeah.
evaluation, so you put in the heart failure, they program it right from the start, correct?
So this is automatically set up. All the trends is set up. The only thing
It doesn't have to be a special order or
no,
anything?
No, every patient this is set up on. Every time you order like this is set up. So, you know, we've actually got captured where we've been able to bring patients in the clinic, in the heart failure clinic, early and get them tuned up so they never get readmitted. So this could help with readmissions for patients. It may be a patient that ran out of money and can't afford their meds and stopped taking their meds. You know, and then you see their heart rate normal, and then all of a sudden they go up. So, so this is great information right here.
I'll be on my way back.
Go back up to the scroll back up.
Thanks.
Courtney. If you want to dig deeper, you can go to each tab. So go to the heart rate tab there. And this can tell you in 5-minute increments what's going on with their heart rate. All right. Click on, let's say July 12th. You can scroll over your cursor over that and you can see, so these are 5-minute increments here. If you see that dash, that means there was so much artifact on that, in that 5-minute increment that it just had to put a place marker, a dash there because it couldn't read their heart rate. But you can see throughout the day their heart rate, what's going on in 5-minute increments. And if Courtney scrolls over that, it'll tell you, just scroll over one of the little dots. It can tell you, okay, at, you know, at 2:35 that day, their mean heart rate was 94 beats per minute. So we can get that detailed into them. Same thing with activity, same thing with their body position. So basically I just wanted to show, you know, besides being a shock box, that our primary function as LifeVest is to save lives. And we save about 3 lives as a company a day with the LifeVest. But there's a lot of other information here that could be utilized to help with patient care as we use it. So that's kind of what we're looking at here.
So the big question is getting access to that, because you have
Right.
to be on their chart as a provider in their chart, correct?
Well, yes. So, like, we set you up in LifeVest Network. Then, let's say another one of your providers ordered the vest. And say we haven't linked that patient to you yet. Call me, and we can,
Link
like,
it.
in 5 minutes, I can have it linked over to you. With all I do is make a phone call, and I can have it linked over to you. You can say, Jim, I just need access to this patient. I'm treating this patient today, and the fact that you're treating that patient today gives you access to it.
All right, so if we're seeing them in the ER for heart failure and they're wearing their vest,
Right.
you can give us access, and then we can look at that information and print it all out. Will it
Yep.
print to our printers?
It will print to your printers. Yep. All you gotta do is go here, generate report. So this is the ECG strip. On the ECG strip, you can see there's 2 channels. There's a side-to-side channel and a front-to-back channel. Just scroll across that. So you can look at the channels.
How do you scroll on this? 'Cause
Um,
I'm so used to my.
That's fine.
Screen.
Let's see it.
So used to my.
So,
No,
down at the bottom, so you can scroll across and see what's going on with that patient. If you wanna see, it's got calipers on here too, so if you wanna see what's going on and see what the rate is, 181 beats per minute on that one. So you can actually put the calipers on it and see how fast it is. So just so you know, there's two channels of ECG. When it prints out, it prints like on top of each other. So if you're reading, you read every other strip. Don't read one strip across or you'll miscalculate.
So that's the 2 leads you're seeing right there.
Yeah, and there's a de-identify box up here. So if for some reason you want to de-identify that strip, just click on that de-identified box to generate your report, and it'll take all the patient's name off of it.
that's what I'll do a lot of times if they're in the ER and someone has downloaded and we see something, I can send it to your phone directly too.
And just de-identify
I
it.
de-identify it and send it to you so that you can view it and
Yeah.
get it immediately.
So we're always real conscious about making sure we're not breaking HIPAA laws and stuff like that, so.
Because this is very useful for the nursing staff too, for patients who said, you know, I've been feeling terrible, whatever, they could potentially do this if it hasn't been done.
Right.
They could download it and you just talk to you and you'd put them on the system and then they could.
Yeah, well, that's probably gonna be a little challenging for the nursing staff, but they
Okay.
can always call us and we can send over the reports.
Get the report.
Fax them over, or it gives an email, we can, like Courtney said, we can email them to you and stuff like that, so. So right now, we're setting up providers, but, you know, if y'all have a question, call us and we can definitely get you the information.
And can you get an EKG from each of those heart rates, where those dots were?
So the,
Where the heart rates were,
no,
you know, the dots?
no, so only on the recordings, you mean?
Yeah, so you've got this EKG right now.
Right,
And then you would do what showed the heart rate.
right.
You know, those dots of heart rate, can you do an EKG for each of those?
No, because
Just
that
the
would
heart
be,
rates.
that would be like a Holterman
Lot of
recording.
information.
That'd be a lot, I mean, we'd have to get a wheelbarrow bringing all the.
Okay. Okay.
So, what do you think? Good stuff? So,
We
more
can
new thoughts in
utilize-
there?
we can utilize it a lot more.
Yeah, I mean, there's a lot of information here that people don't realize, and so we're trying our best to get people set up. I'm trying to figure out the best way, working with Stacy and Mary to try and get all of you linked up with providers and so forth. So,
And if you download this for us, or print it for us, or you get a report for us, can we get it into their chart, their Epic chart?
that would be your
If
IT.
we
I don't-
send it to you mean electronically into their chart? So I know that, only from being in the lab, I know that there is a way that you can, someone comes around, picks that up and scans that into their
Right,
stuff.
it would
I
have
do
to be
know that
scanned
it'd
in.
have to be done that way.
Cause it's a lot of paper.
Yeah, yeah.
Okay.
If
So
it's
it's not like you
emailed,
speak to each other.
John, if it's emailed, we could snip it and then snip it
Yeah.
into another.
Yeah, but there's lots of pages, I think, right? There's-
Well, some of them can be 10
Depends.
pages. some of them
Depends
can-
on the info.
Yeah.
Yeah, but like that one picture where all those graphs were would be a really good snippet,
Right.
yeah.
Yeah, go back to the trends, summary, you talking about the summary page? Yeah, I like that summary page, I like to print out and have in the, like I've seen doctors have it in their chart, and when they go in to see a patient and have that information right there. Because on the summary, and you'll see, just go to, yeah, just click on Adams again. Perfect.
Yeah.
So this is a summary page. Now, this patient didn't wear it long enough. What you'll see is a black line somewhere about right here going down the center here. And everything to the left of that black line is in week increments. What is it, last 14 days they wore it?
Yeah.
And then everything to the right of that black line is days, last seven days. So you have,
his first 7 days.
yeah, so you'll have it in weeks over this side and days, so it shows you a 7-day printout. That's so, just so you know, this one doesn't have it, but there will be a dark black line down the middle, and everything to the left of that line is weeks, and everything to the right is
When
days.
you generate your report, you can pick your date range as well too.
Sure, yeah. So, questions? Anything? All right. Sorry to make you wait.
Thank you.
You're welcome.
This was Katie's.